Community public health is extremely important because not only do genetics and other individual choices manipulate your health, environmental factors do as well. Our population is expected to grow, and with the baby boomer generation reaching retirement ages, we will see an ever-increasing demand for healthcare workers, public health officials, and outreach programs to help communities become healthier and lead more active lifestyles. Fries and Filbert 2013 state the built environment, human-constructed features of the physical environment, has substantial impacts upon the health of the community. The CDC describes the built environment as a public health issue of major importance. The built environment includes all of the physical parts of where we live and work: homes, buildings, streets, open spaces, and infrastructure. The built environment influences a person's level of physical activity. For example, inaccessible or non-existent sidewalks and bicycle or walking paths contribute to sedentary habits. These habits lead to poor health outcomes such as obesity, cardiovascular disease, diabetes, and some types of cancer. Organizational performance is extremely important as well because it promotes healthier, more active lifestyles. It also helps communities to maintain their health statuses to avoid chronic illnesses that are reaching all-time highs. Public health aims to help spread the word and educate people the dangers of unhealthy habits like smoking, unprotected sex, drug use, exposure, and toxins. Beach, Brooks, Grigg, and Menachemi 2006 state a strong infrastructure is required to perform the 10 essential public health services identified by U.S. public health officials in 1994 and described elsewhere, and to repeat and to protect the public from environmental toxins, influenza, chronic diseases, and unacceptable rates of infant mortality. Moreover, if they are to be responsive, state health agencies must be able to provide the core functions of public health: assessment, policy development, and assurance across the domains of health protection and health promotion activities. Public health and other community wellness programs aim to improve people's health, birthing outcomes, improving child wellness, and managing chronic illnesses for those in need of advocacy programs or educational programs to address the importance of public health and living a healthier lifestyle. Bazikar, Rosenthal, Braunstein, Rush, Matos, and Hernandez state, with the fundamental changes currently seen in public health and the financing and delivery of healthcare services, we now have an opportunity to work towards shifting current healthcare systems to ones with a patient-centered perspective and a preventive approach in which community health workers, as members of community health teams, can help to create systems that are actually seen as more appropriate and accessible by community members and society at large. With the passing of the new Patient Protection and Affordable Care Act, our country will be coming to a new era of health care and are focused on providing more individuals with quality health care. The plan is to educate and promote healthier lifestyles in order to lower the number of deaths caused from chronic illnesses, sicknesses, and to inform people about unhealthy habits. Du Bois state and Graff state, medicine's current evidence base is insufficient for many of the decisions made daily by clinicians, patients, purchasers, and policymakers. The Patient-Centered Outcomes Research Institute represents an effort by the U.S. government to address this shortcoming by funding comparative effectiveness research, prioritizing that research will be a critical first step. Communication is becoming more and more important throughout our healthcare industry. Informing and educating is also the top priority for the United States. Through public health programs, our country is aiming to improve the overall health status for millions of Americans. The number one cause of death is heart attack or stroke, which can be avoided if the right precautions are taken. A lot of the chronic illnesses that are present today are avoidable through living healthier lifestyles and getting plenty of exercise. Valentin Mahir Atkin Bliss states, chronic illness and infectious disease are major contributors to the status of health in the United States. For health promotion and disease prevention to be broadly effective, it is necessary to address determinants of health on a population. It is necessary to address as well as an individual level. The U.S. Department of Health and Human Services, in its Healthy People 2020 framework, has placed an increased emphasis on addressing population-level determinants of health. This is reflected in a commitment to an ecological and determinants approach to health promotion and disease prevention, and the designation of a new inclusion in the overarching goals to create social and physical environments that promote health for all.